Adelaide Community Healthcare Alliance Incorporated, known as ACHA, is one of the largest private hospital groups in South Australia. ACHA is comprised of Ashford Hospital, Flinders Private Hospital and the Memorial Hospital, and all are accredited with the Australian Council on Healthcare Standards.
ACHA provides a wide range of high-quality healthcare services, offering a broad range of acute medical, surgical, obstetric and rehabilitation specialities.
The ACHA hospitals are conveniently located across Adelaide.
ACHA employs over 2,000 staff and has more than 1,400 accredited visiting medical specialists and more than 50 volunteers.
ACHA is proudly community-based and not-for-profit, with any surplus funds reinvested into the organisation and utilised in upgrading patient facilities, services and equipment.
A long-standing connection with the Uniting Church is part of the ACHA story. Our hospitals have on-site chaplains who provide support to patients, their families, staff and VMOs, whoever they are and whatever beliefs they hold.
Since 2003, ACHA has enjoyed a contractual agreement with Healthscope Operations that sees ACHA retain responsibility for strategic direction and governance, while Healthscope takes care of daily management and operations.
Ashford Hospital has 230 beds, 10 operating theatres, 2 angiography suites and an emergency department. Supported by the latest technology and robotics, Ashford Hospital specialises in cardiology, general surgery, general medicine, gynaecology and maternity, oncology, orthopaedics, urology and vascular surgery.
Flinders Private Hospital has 153 beds, 9 operating theatres, a 24/7 cardiac emergency centre and 3 angiography suites. Flinders Private Hospital is co-located with Flinders Medical Centre and provides a range of acute clinical services including cardiology, cardiothoracic surgery, colorectal surgery, ear, nose and throat surgery, neurosurgery, oncology, chemotherapy and radiation, orthopaedics and urology.
The Memorial Hospital is a 98-bed hospital with a 100-year history and has a range of specialties including ear, nose and throat surgery, neurosurgery, ophthalmology, orthopaedics, spinal surgery, paediatric surgery, plastic and reconstructive surgery and rehabilitation programs. ACHA is proud of the high standard of compassionate care we provide to our patients.
ACHA head office and secretariat functions remained with ACHA. The agreements are referred to as the HOMA, Hospital Operations Management Agreement, and the FOMA, Flinders Hospital Operations Management Agreement, and are in place until 2033. The ACHA board manages and oversees the agreements. Under these agreements, ACHA has outsourced to Healthscope some business functions, including IT, people management, payroll, industrial relations and procurement. While the management of ACHA's 3 hospitals has been integrated in the main with Healthscope's systems and process, there are important differences to be aware of. ACHA is independent of Healthscope and has its own board of directors representing ACHA's members. The ACHA directors are elected and appointed in accordance with ACHA's Constitution and the Associations Incorporation Act 1985, SA. As a registered charity, ACHA also operates under the legal requirements of the Australian Charities and Not-for-Profits Commission, the national regulator of charities. The ACHA Foundation Incorporated, a registered charity with the ACNC, supports ACHA's hospitals by providing funds for medical equipment, facility upgrades and other programs. Also a registered charity, it is separate from the agreements between ACHA and Healthscope. The ACHA board is responsible for the overall strategy, governance and performance of the ACHA group of hospitals. ACHA has its own board-appointed committees including an audit committee, pastoral care committee and the nomination and remuneration committee. The CEO, Hospital Operations ACHA, reports to the ACHA board and is responsible for the overall management of ACHA's hospital operations, the development of strategic and business plans. While the same payroll system is used for both ACHA and Healthscope employees, both organisations have individual enterprise agreements with various unions. While ACHA's policies and procedures at the corporate level differ to those of Healthscope on account of ACHA's charity and not-for-profit status. ACHA has its own code of conduct, medical regulations, medical advisory committee and insurance policies. Accreditation for ACHA's visiting medical specialists covers all 3 hospitals. ACHA's hospitals undergo the National Safety and Quality Healthcare Standards as one organisation-wide assessment. Required statutory reporting is lodged under ACHA's name. To minimise misconceptions, when ACHA's hospitals are referenced by Healthscope in newsletters, publications, internal communications, and especially for anything publicly available such as the website, a simple statement should be used for clarity. Wording such as Adelaide Community Healthcare Alliance Incorporated, ACHA, comprises Ashford Hospital, Flinders Private Hospital, and the Memorial Hospital. ACHA's hospitals are managed by Healthscope, can be used. ACHA usually adopts the initiatives and upgrades rolled out by Healthscope, which are then rebranded for ACHA to use. Issues do arise when the differences between the 2 organisations are not taken into account. The relationship between ACHA and Healthscope can be complex and quite simple at the same time. Understanding the relationship between the 2 organisations, the expectations under the HOMA and FOMA agreements, and knowledge of the areas of difference can avoid confusion.